Senator from Suffolk, Ms. Chang-Diaz.
I rise in support of this amendment, and I do so because I am profoundly proud of the way that we as a state have followed our values over the past 8 years in taking bold action, and bold action even when it's scary to do so, in order to change the way that health care works in our state. We have committed ourselves, again, even when it required boldness, to the idea that our people should have access to basic, quality health care, all of our people. And now 97% of our population in Massachusetts does have health care coverage. No other state comes close to that, and it is an accomplishment that can make all Bay Staters stand a little taller and a little prouder. And this amendment is about continuing that tradition of boldness when it comes to pursuing our values. In this case, our value of protecting our constituents' financial interests. I also rise in support of this amendment because I'm committed to data and the truths that data have to tell us. This bill is committed to data. This bill loves data, which is one of the things that is so great about it, because it is, in that commitment, at once both humble and bold. The bill is humble because it says we don't know all of the right answers right now. We don't know all of the right moves and all of the right tactics to get us to the ideal system from our vantage point today. But if we follow the data, the bill says, it will point us to the right moves. And it's bold because it says we will follow that data. We will act on the truths that the data tells us, even if that means that we're going to have to change the way that we do things. Massachusetts has shown the nation once that we aren't afraid to be innovative with health care reform, and our innovative spirit has paid off. And so what this amendment does is it seeks to move us forward even further. It puts into law the commitment that we're pursuing not just reform, but the best reform, the best options for health for all of our residents, and the best options for long-term fiscal health of our state. Now, I believe, personally, that the evidence supports that single-payer is that option, is that best option. Numerous studies suggest that beyond providing truly universal coverage, single-payer is actually a more cost-effective, efficient, and effective, and it's important to note that, effective when it comes to ensuring health outcomes, than the current system we use here in the United States or in Massachusetts. Overall, per capita health care costs in the U.S., as the gentleman from Acton noted, are 2 to 3 times that of countries with single-payer systems, and our costs have risen even faster. Much of those costs come, if those were costs that were going clearly to keep us more healthy, we might say, fine, that's worth it to us to make that expenditure. But much of these costs come from health industry administrative overhead expenses, what you might call privatized paper pushing. A study in the New England Journal of Medicine, our own New England Journal of Medicine, found that health admin costs totaled at least, and I want to ask you to focus on these numbers because they are astounding, that health admin costs totaled at least $1,059 per capita in the United States as compared to $307 per capita in Canada, a country with a single-payer system. I'm going to say those numbers one more time. In the United States, health care administrative overhead expenses per capita, over $1,000. In Canada, just over $300. We are spending over 3 times as much on administrative overhead here. And the question then, Madam President, becomes, are we healthier as a nation for this additional spending we're doing? And a systematic review of 38 studies examining health outcomes in the U.S. and Canada has found, Madam President, that the answer is resoundingly no. Although the U.S. spends far more on health care, the Canadian system achieves health outcomes that are similar, if not superior, to the U.S. at a much lower cost. 34% of Americans are obese compared to just 24% of those in Canada. Americans are 42% more likely than Canadians to have diabetes, 32% more likely to have high blood pressure, 12% more likely to have arthritis. And perhaps in the ultimate measure, life expectancies in the U.S. are 78.2 years, and in Canada, 80.7 years. A lot of arguments have been made in the discussion of this bill that we should not move too aggressively as a legislature to control costs because of the role that the insurance industry plays in our economy, which, to be sure, is a substantial one. But again, the question we've got to ask ourselves is, does the spending that we do on this industry make us any healthier? Because the fact is, there are a lot of other jobs that could be created with the money that we now choose to spend on that industry, that we make through that spending significant in our economy. We could choose to take that money and create a lot of other jobs in other areas, jobs that might be integral to increasing our health outcomes, like primary care provision, like research, jobs in other sectors that we'd like to see grow and drive job creation here in Massachusetts, more teachers at the front of our classrooms, another grocery store clerk at the grocery store in my district that is struggling under the cost of increasing health care premiums, another car mechanic at the mom and pop shop down the street, any number of other jobs that we might be able to create with the money that we are now choosing to spend on administrative overhead that is not demonstrably making us any healthier as a state. And the fact is that these are jobs that our public and private sectors will be able to afford if we move this money that we now choose to spend in one place over to a place that could potentially fund all kinds of functions that we value as a society. But even though I think the evidence so far indicates that single payer is our best bet for accomplishing these goals, even though I think that, this amendment does not presuppose that that's right. This amendment does not begin with the assumption that I'm right, or that the gentleman from Acton is right, or that any other supporter of single payer in this chamber is correct. This amendment simply says, let's look at the data in a few years. Let's look a few years into this round of reform and see what the data shows us about the right next steps and the best next steps. This amendment will give us the opportunity to implement the great cost containment, and I want to underline that, the great cost containment provisions in this legislation, while also keeping our focus on the possibilities for improving our system even further. The amendment, by its very nature, is set up to ensure that our Commonwealth is pursuing the most cost-effective option for our taxpayers. This bill, Madam President, places a high premium on following the data where it leads us. And I ask that we really commit to that ethic by passing this amendment. I hope the amendment passes. Thank you, Madam President.